I had an appointment today with a new doctor, and wow, he was such an idiot. He did not listen to a word I said. He didn't believe me when I described my issue to him. He was incredibly condescending and rude. He talked to me like I was stupid. At one point, I started tearing up because of how upset he made me, and he didn't give a crap. He had literally no bedside manner or sympathy. I had to walk out because of how terrible he was being. Some people truly shouldn't be doctors. This man said that my past eating disorder, in which I lost a lot of weight and became unhealthily thin, really wasn't that bad. I hate this guy. I lost 30 pounds insanely fast, even though I really thought I didn't need to lose any weight at all. I ate 800 calories or less, usually less per day. I counted the calories obsessively. I body checked constantly. I over-exercised every single day. I made myself throw up after eating, and my period stopped. My mom almost hospitalized me. But yeah, it wasn't that bad. Update. Thank you everyone who has said I should report him. I was hesitant, but I don't want anyone else to feel the way I feel. He has been reported to the Texas Medical Board. I have contacted the practice and made several negative reviews online. I had a physician's assistant tell me, you really need to educate yourself on how to take care of your mother. When that's all I've been doing since she had a stroke in 2018. I broke down into a full-blown panic attack. She was a bit nicer after that. I work in healthcare. One of my most worst moments was when I, a therapist, was seeing a patient and he began to develop signs of a stroke. I alerted nursing. When they seemed unconcerned, I found his doctor on the rehab unit. She did not care. He had a major stroke. I saw him after he got back from the ICU, and he was a completely different person. It was utterly heartbreaking. I was on this unit for 3 months and multiple times had run-ins with the doctors where things were seriously wrong, and they didn't give a crap. Same issue here. I'm a minor with hearing issues, and my doctor refused to get me a referral to an EMT to get my hearing checked because I am too young for that. As someone who works at the bottom of the totem pole at a hospital, a nursing assistant, yes, I always feel like the way doctors treat me says a lot about how they treat patients. If doctors can't be kind to a low-level hospital employee, how must they treat the mentally ill, or the addicts, or other people? On the contrary, I have doctors who are so kind and even ask me about patients because my position actually spends the most time with them. While I definitely know amazing doctors who don't have stellar bedside manner, I feel like being a normal, trustworthy person makes someone 100,000 times better doctor. Yep, I think a lot of people spend so much time studying and grinding to be a doctor that by the time they are, they've forgotten what it's like to work with people. Being a doctor isn't all about diagnosing ailments, it's about listening to people and talking to them and trying to understand what could be the real underlying issue. I wish more medical professionals would remember that. Yep, I once went to an urgent care because I was having suicidal thoughts. I think I was 19. And the PA did not look up from his notes once, except when I answered yes to the question, do you have thoughts about hurting yourself? My dad, who teaches at a med school, my sister, and several others close to me are all doctors. I've met more med students in my life than anyone who isn't in med school. I can tell you that probably about a fourth of them are there because of parental pressure, or they just want to be a doctor for prestige. They don't give a crap about people. It's really sad. But it's our reality, and you are not alone. Wishing you the best. I hope you find one of the other three-fourths who actually care. Went in to get my first ultrasound when I was 3 months pregnant. The ultrasound woman was looking forever, never saying what she was doing. And she finally just said, "I can't find a heartbeat." I was alone and I was kind of sitting there like, "What?" And she said, "Your baby died." Then she left. I was so stunned. I'll never forget that witch. This January, I was hospitalized with a swollen esophagus. I was unable to eat or drink normally. It would gurgle back up into my mouth for about a month and a half. I went to see a gastroenterologist and brought as much info as I could because this past year I've been experiencing a slew of weird, severe, and debilitating inflammation issues. I thought they could be related to what was happening in my upper GI tract. He did not examine me. He told me that I was overthinking my symptoms and that he would do a scope just to make me feel better. "At least you don't have cancer," he said. He prescribed me fun and told me to go home and eat a pizza. I left without a word and broke down in my car. Not having the medical support you need when you already feel helpless in your symptoms is awful. I had a psychiatrist diagnose me as bipolar recently after a 45-minute phone call. She scared me pretty badly and was high-pressure salesmaning meds. My husband calmed me down after the fact and I closed my services with them. I had to talk to her to get a therapist for my birth trauma. Not worth it. This was just a month or so ago, and now I'm scared to talk to someone else. I wish I could say that this was my only experience with psychiatrists being awful, but it isn't. That's it for today's episode. Well, I'm sure we've all had encounters with doctors, especially during this trying time with the pandemic and all. It's important to get the support you need. Now, if you are unhappy with the medical professional you are currently dealing with, feel free, and you should, find someone else. Now, it may cost a bit more, but it'll be less of a headache. Thanks so much for listening. If you liked the video, please click like and subscribe. Bye!